Okay.
Sir, please mute all the participants. Sir.
हाँ मी करतोय. तुम्हाला पण करतोय 1 मिनिट मग अनम्यूट करेल.
धनंजय सर नमस्कार सर.
हाँ सर, very good afternoon sir.
Very good afternoon sir.
हॅलो
सर बाजारे सर आलेत ना?
हो आलो
आले अनिल बाजारे सर नमस्कार सर.
आले बाजारे सर आले.
ठाकर सर नमस्ते.
नमस्ते सर नमस्ते.
Morning sir, good afternoon sir.
हॅलो धनंजय सर.
हाँ सर, shall we start sir?
We start.
बाजरे सर नाही आले का?
आलेत ना बाजारे सर आलेत.
बाजारे सर आले. अनिल सर राईट.
अनम्यूट करावं.
सचिन आला का? सचिन
बाजारे सर प्लीज अनम्यूट करा तुमच्याकडनं.
Participant कितने हुए?
बाजारे सर प्लीज अनम्यूट युअरसेल्फ. अनिल बाजारे प्लीज अनम्यूट युअरसेल्फ. यस गुड.
सचिन पाटील जॉईन झालं का?
झाले वाटतं.
हा झाले. आहे.
डॉक्टर सचिन प्लीज अनम्यूट युअरसेल्फ. Dr. Sachin, unmute yourself. Good.
Sir, I am in.
Yeah. So, good afternoon, everybody. I request Dr. Dhananjay Kulkarni, sir, to please host the meeting and please continue with your words.
Good afternoon, everybody, all the dignitaries and participants. I would like to request Dr. Anil Bazare, sir, our dashing and dynamic Secretary of Maharashtra State, NIMA, to please introduce our learned speaker, Dr. Pathan, sir.
1 minute, please. Hello. Hello. Hello, everybody. First of all, I would like to thank and congratulate. Hello. Can I? Can?
Yeah.
You are audible. Properly
You are audible.
Yes, you are audible, sir.
Okay. First of all, I would like to thank and congratulate NIMA-CC, Pathology Society of India, NIMA-CC, NIMA Legal Committee, and all the dignitaries who have arranged this series of lectures on different subjects and topics for our members in all over India. And I will mention here that the series is going very successful. Today, I thank to the legal committee of NIMA-CC to give me this opportunity to introduce Dr. Mujahid Pathan, who is today's speaker. I would like to brief some words in the favor of his introduction to all of you. So, Dr. Mujahid Pathan, sir, it is my pleasure to introduce Dr. Mujahid Pathan. He is our NIMA member from Mumbai branch. He is BMS, MBA, and LLM, all from Mumbai University. He is a family physician and medical legal advisor in Mumbai. He is also convener of Legal Activity Committee and Assistant Secretary of NIMA Mumbai District Branch. He is medico legal advisor of Dr. J.B. Naik Central Legal Committee, New Delhi, India. He is also medical legal advisor, NIMA Mumbai District Bench and Maharashtra State Bench too. He has done his MBA in Hospital Administration and Healthcare Management and LLM in Criminal Law and Criminal Administration. This is a short introduction of Dr. Mujahid Pathan. I would like to mention more about Dr. Mujahid Pathan, that he is very active and member and active legal advisor of NIMA Maharashtra. He always help us in the all legal matters and cooperate and assist with Dr. Kothade sir, Dr. Khatawkar sir, Dr. Dhananjay Kulkarni sir, and all the legal committee members. So I would like to say Dr. Mujahid Pathan, request him to please deliver his lecture.
Thank you very much, sir. Thank you, Anil Bazare sir, for such a wonderful introduction. With all your permission, I would like to start my lecture. A warm good afternoon to one and all. Respected President of NIMA Central Council, Dr. Tebunikar sir, and dignitaries of the NIMA Legal Cell, Dr. Nitin Kotle sir, Dr. Khatawkar sir, Dr. K.T. Patil sir, Dr. Dhananjay sir, and our President of NIMA Mumbai District Man, Dr. Sanjay Londe sir, and to all the participants who are attending today's webinar. I feel honored and privileged to here with you today, and I wish to thank our NIMA team, Dr. Grish Daga sir, Dr. Gajanan Dhadve sir, Dr. Alok Gupta, who has arranged a wonderful NIMA webinar series lecture, and with the great efforts of legal team, suggested me as a guest speaker. I welcome all the participants and wish you all the best. Today in the segment of webinar, I will be discussing about the medical certification of cause of death and ICD coding, that is International Classification of Disease. So, my dear friends, let me first start with that. A doctor's role today is not just limited to being a clinician. The scope of his professional duties has been extended. Besides being a skilled clinician, he now also needs to have knowledge of how the law works. Above and beyond this, a doctor also needs to take care that he does not violate any rule laid down under the Code of Ethics or Code of Conduct, which defines the uniform standards of practice. A doctor must always maintain the highest standards of professional conduct. We are also expected to keep ourselves updated with all the advances or developments in our field. By today's webinar, it is an attempt to educate our friends about the medical certification of cause of death and ICD coding, and also to practice ethically and legally and to safeguard ourselves. So my dear friend, medical certification cause of death. In India, the Births and the Death Registration Act 1969 requires that all deaths to be certified by the medical practitioners only. Deaths are certified through the process of identifying the cause of death and reporting it on Form 4 and 4A. These forms are legal documents that families use to register deaths, but they also serve a greater purpose. Therefore, the physician's responsibility of correctly identifying and reporting the cause of death is very important for health policy and planning. In January 2016, the Registered General of India implemented an online birth and death registration system at so-and-so csorgi.gov.in. With this online registration system, the correct documentation of the cause of death is even more important because of the automated coding of the underlying cause of death. Even a small mistake in entering the cause of death may affect the count of main cause of death. This can have crucial implications to policymakers and program managers. The fact of life, everyone are aware that fact of life is man is mortal and death is inevitable. Death is a universal truth of life. A person who is born should die. An inevitable end of human life is death. So, according to Registration of Birth and Death Acts, death means the permanent disappearance of all the evidence of life at any time after live births had taken place. Death is an inevitable event in every person's life. However, the structure of the modern society has necessitated that due to be authenticated by the medical profession. Therefore, the doctors have to bear and carry out this responsibility with all fairness and pragmatism. Issuing a death certificate is one of the generous duty of a general practitioner, which can have medico-legal implications. The general practitioner must verify all the relevant facts before issuing a death certificate and should not issue a death certificate under any pressure. A doctor should do this utmost to arrive at the cause of death or at the probable cause of death. The cause of death is to be based only on the clinical findings and not on extraneous factor. Death certificate and cause of death is to be issued only when the treating doctor is fully satisfied as to the clinical diagnosis and corroborative diagnosis. For example, electrocardiogram in acute myocardial infarction, cerebrospinal fluid in meningitis. A doctor may certify death, but the cause of death is to be issued only on verification and after satisfying all facts of the cause, causing and resulting in death. In case of suspicion of death due to unnatural causes, the doctor may also certify death and do not cause of death and will inform police for further investigation and postmortem. Before issuing DC, the doctor must verify and ascertain the name, age, sex that we will see in detail in the next slide. And correction required later in the above mentioned points result in a lot of inconvenience to the next of a kin and may cause delay in finalization of death claim. Now, what are the social issues related to cause of death certificate? The certificate is a predicament in any doctor's practice. Predicament means nothing but a difficult or unpleasant or embarrassing situation. Every doctor has to face a situation where he or she has been in a dilemma whether or not to issue a death certificate. The relatives of the deceased may plead, they may persuade, they may pressurize, even offer a price, and at times even threaten for the doctor. He or she may be tempted to issue a death certificate in doubtful situation, purely on humanitarian grounds or for the fear of losing clients. But the doctor is advised to apply great caution while issuing a death certificate, as the final certificate may unwittingly help in destroying evidence of a crime. Once the body is cremated, the evidence is lost. In such a situation, the doctor may find himself in trouble with the law. In India, the general practitioner is usually considered a family physician and has a regular client. Whenever required, this patient attend the GP's clinic. If a regular visiting patient who has not been examined recently by the doctor dies suddenly, the doctor is in a dilemma about whether or not to issue death certificate. A similar situation is often experienced by the GP when called to attend a critical ill, unknown patient who is staying as a visitor or guest in the house of his acquaintance or his regular patient. If such a patient dies before receiving any treatment from a doctor, social pressure may be brought on the GP to issue a death certificate. If the GP has seen and treated the patient in the last 14 days, he justified in issuing the DC. Otherwise, he may land up with a great problem. The GP is advised to properly explain the situation to his family patient or acquaintance and politely decline or say big no to ill under pressure. He or she is further advised to guide the family on further proceedings to obtain the DC. The patient usually appreciates such steps of doctor and there is less chance of losing one's client also. Now let's come to our point, the definition of death. Death is nothing but a total stoppage of circulation of blood and consequent thereupon cessation of vital functions, which has classified into the somatic death and molecular death. Somatic death is nothing but the complete loss of sensitivity and the ability to move. There is complete cessation of functions of the heart, the brain and the lungs. Molecular death is death of tissues and cells individually. Now the legal definition of death according to Transmission of Human Organs Act 1994 is, deceased person means a person in whom permanent disappearance of all the evidence of life occurs by reason of brainstem death or in a cardiopulmonary sense at any time after live birth has taken place. The brainstem death means the stage at which all functions of the brainstem have permanently and irreversibly ceased. Now, how we can test the circulation have been stopped? By oculocephalic presentation, the oculocephalic test, that's moving the head on both the sides, vestibulo-ocular test using cold water, by eye examination, by application of heat, by cutting a small artery, and by ECG tracing. Cutting a small artery means, can a dead person bleed? No, the dead normally can't bleed for very longer. Liquor mortis is a stages of disease in which there are the stage of disease, stage of death or decomposition, that is called labor mortis, algar mortis, and rigor mortis. Everyone may be aware of the rigor mortis. The labor mortis is a condition of discoloration of the body, and the algar mortis is the coldness of the death. And the rigor mortis is a few hours after a person dies, the joints of the body stiffen and become locked in a place. This stiffening is called rigor mortis. Depending on the body temperature and other condition, rigor mortis lasts approximately for 72 hours. How the respiration stopper test has been done? Mirror in front of open mouth and nostrils, feather or cotton fibers in front of open mouth and nostrils. Also, how can we testify the brainstem death? By pupillary reflection, by extraocular movements, by corneal reflex, by gag reflex, by cuff reflex, and by EEG reflex, that is electroencephalography. Now come to the point of classification of death. Immediate cause of death is a condition at the time of terminal event, and antecedent cause of death is the pathological process responsible for death at the time of terminal event or prior to or leading to the death. Other contributory condition, that is pathological process involved in or complicating but not causing the terminal event. A manner of death is nothing but the cause of death is in which a cause of death is produced. Mechanism of death is a physiological or biochemical disturbance produced by the cause of death which is incomplete with life. An agonal period is nothing but a agonal breathing or agonal gasps are the last reflexes of the dying brain. They are generally viewed as a sign of death and can happen after the heart has stopped beating. Now we come to the underlying cause of death, which is very important. Underlying cause is nothing but the disease or the injury that initiated the train of morbid or chain of morbid events leading directly to death. The circumstances of the accident or violence which produce the fatal injury. Now come to the importance of death reporting. It is mandatory to document the cause of death before burial or cremation of the deceased. The death certificate is a permanent and legal record that provides information about the deceased such as his or her age, sex, determinant of date of death and cause of death. It is also used for the settlement of the state, application for the insurance benefits and settlement of pension claims. It is a source of statistical information. The death certificate is a source of statistical information and cause of death needed for evaluating, monitoring and improving the health of the population and also comparing health across the different regions. Now, this is the overview of the form of medical certificate of cause of death, in which everyone must be aware of. Now, all are expert in our group. All are the senior practitioners, practices long times. This is form 4A, and this is the form 4 and form 4A. Let's see form 1 to fill and form 12 not to fill. The overview of the cause of death reporting form. Since 1948, the WHO has established recommendation in reporting cause of death to allow for international comparison of mortality statistics. These recommendations include the international form of medical certification of cause of death, which countries use in their death reporting forms to meet WHO mortality reporting standards. In India, the reporting of death is a state function. Basically, the constitution has been state the health in a state function, which is supported by individual state laws and the regulation of Birth and Death Act 1969. The standard death reporting form based on WHO reporting form is revised periodically to ensure that the data collected relate to current and anticipated need. The cause of death information should be the physician's best medical opinion. Completing the medical certificate cause of death. As we have seen the form 4 and form 4A. The cause of death reporting section consists of two parts. The part 1, the line A, that is immediate cause. In part 1, the immediate cause of death is reported on line A. This is the final disease or final injury or the complication directly causing the death. An immediate cause of death must always be reported on line A. The immediate cause of death does not mean the mode of death or the terminal event. For example, cardiac arrest or respiratory arrest, which should not be reported at the immediate cause of death as it is unspecific and provides no additional information on the cause of death. Then line B, line C and line D or due to. This on line B, we have to report the disease or injury or complications, if any, that give rise to the immediate cause of death reported on line A. If this in turn resulted from a further condition, record that condition on line C. If this in turn resulted from further condition, record that condition on line D. If more than 4 lines are needed, add one additional line rather than using the space in part 2 to continue the sequence. The word due to, which are printed between the lines of part 1, apply to the sequence with an etiological or pathological basis, usually with a chronological time ordering. The tentative underlying cause of death should be entered on the lowest line used in part 1. Now, the approximate interval between the onset and the death. How we can define the approximate interval? The time intervals are usually established by the physician on the basis of available clinical information, as we can write in minutes or hours or days or years. The term approximately may be used if the time of onset is entirely unknown. State that the interval is unknown. The part 2, all other now the part 1 has been completed in lines A, line B, line C, and line D. All other important diseases or condition. Now part 2, all other important diseases or condition that were present at the time of death and that may have contributed to the death but was not related to the causal chain of events of conditions that may be reported in part 1 should be reported in part 2 of the certificate. It may be necessary to write multiple condition in part 2, particularly for elderly person. Now general key points. This cause of death reporting is to be completed by the attending physician, by medical examiner or coroner certifying the death. We should be consistent, the death certificate should be consistent and precise. Write one disease on one line. Don't add unnecessary details in it. Do not report non-specific events, what we have discussed earlier, such as cardiac arrest, respiratory arrest, or ventricular fibrillation, since they can be specified. Do not abbreviate. And most recent condition is written on top, that is in the immediate cause of death. The underlying cause of death is at the bottom of sequence. Don't write with pencil and don't make any changes or error or correction pen or whatever. If unable to find the cause of death, then write as unknown or probable or presumed cause of death. Usually the tentative cause of death determines whether the death was due to natural or unnatural. Immediately refer cases to medico-legal postmortem if the case is unnatural. Now the common problems in cause of death reporting. Abbreviations. This should be more than one meaning. And ICD, that is International Classification of Disease Cause of Death coders cannot be expected to know which meaning is correct. For example, MI could mean myocardial infarction or mitral incompetence. AIDS and COVID are the only acceptable abbreviations. Unspecific cause of death. Terms like hypoxia, cardiorespiratory arrest, and respiratory failures as underlying cause of death do not contribute to useful statistics. Eligible handwriting. Make sure your handwriting is legible and use capital letter. Avoid alteration and erasers. Incorrect sequencing of cause of death. Make sure the causal sequencing is logical when considering pathophysiology and time sequence. And outdated forms. Many are using the old forms which has been changed. Use the current form designated by the state or the online portal, since it will always be updated automatically. Signatures and rubber stamps. Obtain all signatures and rubber stamps before submitting forms to avoid delay with written forms. Now completion of cause of death for unnatural. Now see the cause of death for unnatural deaths. The National Health Act stipulates regulations regarding the rendering of forensic pathology service. In these regulations, unnatural death for the purpose of medico-legal investigation of death is defined as any death due to physical or chemical influence, direct or indirect, or related complications. The physical influence would include, for example, motor vehicle accidents and stab wounds, while the chemical influences may be drug overdoses. This part of definitions also includes natural occurrences like lightning related to deaths or dog bites. In addition, if the deceased died due to any complication that can directly be linked to any injury, the case should be referred to forensic opinion. Whether death is sudden and unexpected or unexplained, or whether the cause of death is not apparent, in this case, immediately refer the case for a medico-legal postmortem. Now report considerations. What are the considerations while reporting the cause of death? Legal obligation to provide accurate medical cause of death. The Birth and Deaths Registration Act 1969 places a legal obligation on the medical practitioners to state the cause of death. The making of false statement is a criminal offence, and on conviction, he is liable for a fine or imprisonment or both. The Act requires death to be reported to the local authorities within a period of 72 hours. Confidentiality and legal consideration. Maintenance of confidentiality of patient information is a legal and ethical duty of medical practitioner. Points to be noted, we'll see in the next slide. And when not to issue the DC. We should not issue the DC if the injured is brought dead. We should not issue the death certificate if the crime has already been registered by the police, if the police has already been informed about the case, and if the cause of death is unknown. We should say big no. We should not issue the death certificate during these cases. Now, old age. Death due to old age is also a natural death, and the underlying cause of death then is entered as senility under section 1A. Can someone die for no reason? Yes. However, senility, we'll discuss about the old age. Her senility as underlying cause of death is to be entered only when other disease or its complication has caused death. We see one example. Someone die for no age, this due to old age, that we can see in the coming slide. Avoid the following. Avoid natural causes alone with no specification of any disease. Natural cause is not a cause of death. It is a manner or classification of death. Specify natural causes, exact cause unknown, only if a medical or surgical conditions that may have contributed to the death is also mentioned in part 1 or part 2 of the medical certification of cause of death. Organ failure. Avoid reported organ or multi-system failure alone. For example, congestive heart failure, renal failure, respiratory failure. If an organ or system failure listed as an immediate cause of death, always report its etiology on the lines beneath, that is B, C, D. Mode of death, that is mode of death should not be entered as a sole entry in part 1 or used as the underlying cause of death. This include the terms such as cardiac arrest, as what we have seen before, hypoxia, apexia, and stroke. Also avoid a very vague statement such as cardiovascular event, so and so. And wherever applicable, report in the cause of certification of death, use of alcohol or other substances, smoking history, environmental factors such as exposure to toxic fumes, history of working in the mining industry, etc. Recently, pregnancy is believed to have contributed to the death. Late effects of injury, surgical information if applicable, any heterogenic underlying causes, any diseases, abnormality, injury, or late effects of poisoning believed to have adversely affect the decedent should be reported. This is very important slide. Points to be kept in mind by the medical officer or the general practitioner concerning the issuance of medical certificate cause of death. He should not delay. The practitioner, medical practitioner should not delay for any reason issuing the medical certificate cause of death once he is sure of the cause of death. He cannot charge any fees for issuance of this certificate. This is very important point. We should not charge any fees for issuing the death certificate. He should not withhold issuance of medical certificate of cause of death even if his duties have not been cleared by relatives. No medical officer should sign medical certificate of cause of death in advance, that is before the individual has died, or without viewing and examining the dead body personally. The registration and data analysis process. Once the notification of death has been accepted by the health department, a burial or cremation order will be issued after filling the form 2 at the cemetery by death registration Karkun. The relatives is responsible for completing form 2 at the cemetery. The forms are then registered in the system and stored into batches by date of registration. Medical officers at here in Mumbai, what we call the Municipal Corporation Greater Mumbai, medical officers at the Municipal Corporation of Greater Mumbai ward offices code all the underlying causes of death mentioned on each death reporting from using the current version of the International Classification of Death, that is ICD. ICD-10 is the latest ICD, International Classification of Death. Since 1st January 2016, data is entered into CRS orgi.gov.in, where ICD code is automatically generated in the system. After registration of the death, forms from the ward offices are sent to Public Health Department head office, birth and death section for storage. Now we'll come to the International Classification of Disease. What is ICD? The ICD is the standard diagnostic tool for epidemiology, health management, and clinical purposes. It is used to classify diseases and other health problems recorded on many types of health and vital records, including death certificates and health records. Crucially, in a world of 7.4 billion people speaking nearly 7,000 languages, the ICD provides a common vocabulary for recording, reporting, and monitoring health problems. If a doctor in another country cannot read a person's medical records, they will know what the ICD code means. Without the ICD's ability to provide standardized, consistent data, each country or region would have its own classification that will most likely only be relevant where it is used. Standardization is the key that unlocks global health data analysis. See, continuously we are going. The medical cause of death is over. Now, next topic we are taking the ICDs. Now, the guidance for appropriate recording of COVID-19 related deaths in India. COVID-19 pandemic and need for cause of death. COVID-19 is the infectious disease caused by most recently discovered coronavirus from Wuhan, China in 2019. COVID-19 disease outbreaks were declared a public health emergency of international concern on 30th of Jan 2020 by WHO and later on 11th of March 2020 as a global pandemic. During such situation, mortality surveillance becomes a very important public health tool to assess the impact of viral infection. The COVID-19 as underlying cause of death. Now we are discussing about this new disease which has generated this year. The COVID-19 is reported to cause pneumonia or acute respiratory distress syndrome or cardiac injury or disseminated intravascular coagulation and so on. This may lead to death and may be recorded in line A or B. It is likely that COVID-19 is the underlying cause of death that leads to ARDS or pneumonia. In most of the deaths due to COVID-19 which test positive and symptoms positive. In these cases, COVID-19 must be captured in the last line, that is the lowest line of part 1 of the medical certification cause of death in form 4 and form 4A. Acute respiratory failure is mode of dying and it is prudent not to record in line A, B or C. Patient may present with other pre-existing comorbid conditions such as chronic obstructive pulmonary diseases or asthma, chronic bronchitis, ischemic heart disease, cancer and diabetes mellitus. This condition increases the risk of developing respiratory infection and may lead to complications and severe disease in a COVID-19 positive individual. These conditions are not considered as underlying cause of death as they have directly not caused death due to COVID-19. Also, a patient may have many comorbid conditions, but only those that have contributed to death should be recorded in part 2. Now, the ICD code 10s. ICD code 10s for COVID-19 provided by World Health Organization. Emergency ICD code 10, U07.1 and U07.2. These are the new codes given by WHO. This ICD coding is based on 3-digit categorizes ranging from A00 to Z99. COVID-19 coding in classification of death in accordance with the 10th revision of the ICD coding. The first revision of ICD coding was done in 1900 to 1909. And today we are having the 10th revision of the ICD, that is International Classification of Death. It has been started from 1999 to present. ICD, that is International Classification of Death, is maintained and coordinated by WHO and is updated every 10 years. The emergency ICD code 10, what we are seeing here is U07.1 and the usage condition is COVID-19 virus if virus is identified, and U07.2 if the COVID-19 virus not identified. In this situation, if clinically epidemiologically diagnosed COVID-19 or if COVID-19 or if suspected COVID-19 patient. Public health significance of recording cause of death in COVID-19 pandemic. COVID-19 is a new disease and is a pandemic affecting all communities and countries. Its clinical presentation ranges from mild to severe, and fatality depends on the severity of illness, associated comorbid conditions, and age of patients. Patterns of disease and patterns of death can come from only standardized recording of clinical disease history and cause of death, and therefore epidemiological surveillance of disease and death are important. The data is needed from every district and state in India to measure the public health impact of COVID-19 and to plan for timely health intervention and protect communities. At the same time, other health conditions affecting population need to be also monitored so that the health system is prepared for responding to the needs of population. Now, completing medical certificate of cause of death. Mortality coding of COVID-19 with ICD codes 10. The ICD code strength presently recommended by WHO for mortality coding are: if the test is positive and the symptoms are none, means no symptom, asymptomatic, then diagnosis should be confirmed COVID-19. The code should be used at U07.1. If the test is positive, that is COVID test is positive, and if the symptoms are present, the diagnosis should be confirmed COVID-19 and documented as underlying cause of death, and the code should be U07.1. If the test is COVID test is positive and present with comorbid conditions like heart disease, asthma, COPD, or type 2 diabetes, confirm COVID-19 documented as underlying cause of death. The code should be same. If the virus is detected, code is U07.1. And if the COVID test is negative and the symptoms are present, the symptoms of COVID-19 are present, this is the diagnosis should be clinically, epidemiologically diagnosed COVID-19. If the test is awaited or pending, the symptoms of COVID-19 are present in the patient, then the diagnosis should be suspected COVID-19 and the code should be U07.2. And if the test of patient is inconclusive and the symptoms of COVID-19 are present in the patient, the diagnosis should be probable COVID-19 and the code should be U07.2. Guidelines for health certification for coding. What's the purpose of this document? This document describes certification and classification, that is coding of death related to COVID-19. Okay, a simplified section specific address here. The definition for a disease due to COVID-19. A death due to COVID-19 is defined for surveillance purpose as a death resulting from a clinically compatible illness is a probable or confirmed COVID-19 case unless there is a clear alternative cause of death that cannot be related to COVID-19 disease. For example, trauma. There should be no period of complete recovery from COVID-19 between illness and death. A death due to COVID-19 may not be contributed to another disease and should be counted independently of pre-existing condition that are suspected of triggering a severe course of COVID-19. The guidelines for certifying COVID-19 as a cause of death. Recording COVID-19 on the medical certification cause of death. How we should record the COVID-19 as a cause of death. The COVID-19 should be recorded on the medical certificate cause of death for all decedents where a disease caused or is assumed to have caused or contributed to death. The terminology. What is the terminology of COVID-19? The use of official terminology COVID-19 should be used for all certification for this cause of death. As there are many types of coronaviruses, it is recommended not to use coronavirus in place of COVID-19. This helps to reduce uncertainty for the classification or coding and to correctly monitor these deaths. Now, chain of events. Specification of the causal sequence leading to death. Specification of causal sequence leading to death. Just a minute, specific causal sequence leading to death in part 1 of the certificate is important. For example, in case when the COVID-19 causes pneumonia and fatal respiratory distress, both pneumonia and respiratory distress should be included along with COVID-19 in part 1. Very important, the chain of events. I will adjust my slide just a minute. Specification of causal sequence leading to death in part 1 of the certificate is important. For example, in case when COVID-19 causes pneumonia and fatal respiratory distress, both pneumonia and respiratory distress should be included along with COVID-19 in part 1 of the certificate of cause of death. The certifier should include as much detail as possible based on their knowledge of case as from medical records or about laboratory testing. Comorbidities. This is increasing evidence that people with existing chronic condition or compromised immune system due to disability are at higher risk of death due to COVID-19. Chronic conditions may be non-communicable diseases such as coronary artery disease, chronic obstructive pulmonary disease, and diabetes or disabilities. If the decedent had existing chronic condition such as above this, they should be reporting part 2 of the medical certificate cause of death. Guidelines for coding COVID-19 for mortality. These documents provide information of the ICD-10 codes, which you have seen in the previous slide. That is U07.1 if the virus is identified, and U07.7 if the COVID-19 virus not identified, should be written at epidemiologically diagnosed COVID-19, probable COVID-19, and suspected COVID-19. Details of updates of ICD codes are available online at this portal, which has been given below. That is www.who.in. The classification of coding has been given detail under this website. ICD cause of death coding of COVID-19. Certifies use a range of terms to describe COVID-19 as a cause of death. A sample can be found below. Along both the categories, U07.1 if virus is identified and U07.2 if COVID virus is not identified are suitable for cause of death coding. It is recognized that in many countries, details as to the laboratory confirmation code is very laboratory confirmation COVID-19 will not be reported on death certificate. In the absence of this data, it is recommended for monetary purpose only to code COVID-19 provisionally to U07.9 unless it is stated as probable or suspected. The international rules and guidelines for selecting the underlying cause of death for statistical tabulation apply when COVID-19 is reported on death certificate. But given the intense public health requirements for data, COVID-19 is not considered as due to or as an obvious consequence of anything else in analogy to the coding rules applied for influenza. Further to this, there is no provisions in the classification to link COVID-19 to other causes or modify its coding anyway. The present with pre-existing comorbid condition, if COPD, asthma, chronic bronchitis, ischemic heart disease, cancer, diabetes mellitus lead to complication and severe disease in a COVID-19 positive. Do not consider underlying cause of death a directly not caused due to COVID-19. Why diagnosis should be written on the last line, that is in the part 1 as an underlying cause of death. In COVID cases, in underlying cause of death, that is, it should be written on line D as COVID-19 confirmed, clinically, epidemiologically diagnosed COVID-19, suspected COVID-19 and probable COVID-19. Now take one example. If 60-year-old male, father of COVID-19 patient and a known diabetes since 15 years individual presented with influenza-like symptoms and died, test for COVID-19 is pending. What should be written according to here? The immediate cause should be ARDS since 1 day, and antecedent cause which is not related to ARDS, that we should write NA, that is not applicable, and influenza-like illness since 1 day, and suspected cause, underlying cause of death is suspected COVID-19 since 4 days, and other significant contributing deaths diabetes which is since 15 years. The next example, if a 40-year-old male diagnosed with COVID-19 and has symptoms since last 7 days, he developed ARDS since 3 days and respiratory acidosis since 2 days. Now here the immediate cause of death is respiratory acidosis and the time interval is since 2 days, and antecedent cause which not due cause to respiratory acidosis should not be applicable, and ARDS since 3 days, and underlying cause of death on line B should be written as COVID-19 since 7 days, and other significant conditions contributing to death has not been given. So we should write in part 2 as NA, that is not applicable. Avoid abbreviation and short forms. Though COVID-19, that is coronavirus disease 19, is an abbreviation, it has been specified by the WHO and is an acceptable term to be used as underlying cause of death. Not what to avoid as cause of death or mode of dying. For example, respiratory arrest, heart attack, heart failure, kidney failure, exhaustion, coma. We should avoid writing the cause of death certificate. Now again, I have one example. 76-year-old male with ischemic heart disease developed fever and breathlessness 2 days and was admitted and died in 24 hours. COVID test was inconclusive. Here test is inconclusive. So the immediate cause is here in this acute cardiac injury, and the antecedent cause both are not applicable. And the underlying cause here should be probable COVID-19 since 2 days. And he is having the ischemic heart disease since last 6 months. Avoid abbreviation and short forms. The incorrect and correct. What we should avoid ARDS. We should write acute respiratory distress syndrome, COPD as chronic obstructive pulmonary disease, SARS, that is severe acute respiratory illness, CRF, that is cardiorespiratory failure or chronic renal failure, MI, that is myocardial infarction, myocardial incompetence, AD, that is acute diarrhea, Alzheimer's dementia, MS, that is mitral stenosis or multiple sclerosis, or RTI, that is we write a respiratory tract infection or reproductive tract infection. This should be avoided. Now come to the point. of online registration of birth and death through centralized CRS portal. Now, how to report an event online to the concerned registrar? Whether I'm okay? I'm not going fast, no?
No.
Everyone is audible? I'm going okay?
Yeah.
Okay,
Yes.
sir. No
Okay.
problem.
Thank you. Now, see the online registration of birth and death through centralized CRS portal. How to report an event online to the concerned registrar for registration of birth and deaths. Birth and deaths are registered at the place of occurrence of the event and by the concerned registrar under whom jurisdiction the event has taken place. The institutional events, mean the hospital death events, cannot be reported by the family members. It is duty of the in charge of the institution to report such events to concerned registrar. Through this portal, general public may report only domiciliary or house or home death events within 21 days of the occurrence of the event. If the event has crossed the limit of 21 days, one must approach the office of the concerned registrar of birth and death. To report a domiciliary events within normal reporting period, that is 21 days, fill up the mandatory information to the registrar yourself for reporting of an event through the following link. This login ID will work for a single birth or death. And if there is a case of twins, you may have to create users accordingly, multiple. And this is the portal of this. At the time of sign-ups, users will be able to register for the functional registration unit only. That is, the registration units where this centralized application is being used for registration of birth and deaths, and in the drop-down list of registration unit at sign-up page, only this one. In this way, we have to online we have to register our certification. Now, civil registration system. Civil registration system is a continuous, permanent, compulsory recording of the occurrence and characteristic of vital event. Since we are seeing in the previous slides, these are the events like births, deaths, and stillbirths. In India, the registration of birth and death is carried out under the provisions of Registration of Birth and Death Act 1969, and Registrar General India is entrusted with the responsibilities of coordinating and unifying the activities of Chief Registrar of Birth and Deaths. Chief Registrar of Birth and Death in each state or union territories is the implementing authority, and the registration of birth and death is done by local registrar appointed by the state government under whose jurisdiction the event has taken place. It is the duty of Chief Registrar to compile, publish, and submit the annual statistical report based on civil registration system to the state government, as well as a Registrar General, India. At the national level, about 85. This is the report of 2013 case. At the national level, about 85.6% of the births and 70.9% of deaths are reported to have been registered. Now, what type of documents need to be uploaded in case of death and funeral procession takes place in any village? Under system of registration of births and deaths, the events can only be registered with the respective registrar of the area of place of the occurrence of the event. The supporting documents required for a domiciliary death reported within 21 days of occurrence of the event. Declaration by the, what are the documents needed for this? Declaration by the close relatives or the family member in a prescribed pro forma. Information in a prescribed pro forma, that is form number 2. Address proof of the deceased. Copy of any one of the self-attested documented, if it is voter ID card or telephone bill, passport. Now the Aadhaar card is made mandatory for the registration of this document. Is there any specific time to register death cases online? Yes. The events must be reported within 21 days only. If the event has crossed the limit of 21 days, one must approach the office of the concerned registrar of birth and death for registration of death. What type of document needs to be uploaded in delayed cases? Delayed cases can be registered only at registration unit, and online facility is not available to report delayed cases. The document required for delayed events are, if the delayed days is more than 21 days and up to 30 days, the delayed fee is required, and information prescribed pro forma is required, as form 2 is required. If the delayed day is more than 30 days and less than 1 year, information in a prescribed pro forma, that is form 2 is required. Non-availability certificate, that is form 10 is also required here. Delayed fees and affidavit or declaration by the informant is very important, and permission from the competent authority. If the certification delayed by more than 1 year, then the information in prescribed format is required. Non-availability certificate, that is form 10 is required. Delayed fees is required here. Again, affidavit or declaration by the informant is very important. An order from the first class magistrate is very important if the death certificate is not done till delayed till 1 year. After successful login, users need to fill the complete birth or death reporting form, both legal as well as statistical portion, to the best of their knowledge and belief. Get the print out of this application and forward to the concerned registrar by hand. Now, this is the declaration by the close relative or his family member for obtaining the death certificate to be reported within 21 days of the occurrence of the event. This is the pro forma of the form. Now formats, that registration format. The form 2 is for death reporting format. Form 3 is for the stillbirth reporting format. The form 4 is the medical certification of cause of death for the death occurred in the hospital, and form 4A is for ourselves as a general practitioner, is for the medical certificate cause of death for death occurred in houses, and form 6 is the death certificate, that is Mrityu Praman Patra we call it. This is form 6. This is circular regarding use of Aadhaar number as an identity proof in the registration of birth and death act. I will not go into detail about this one. We have to see the example later on. And the notification required for Aadhaar number for registration of death of an individual. This is to circular to improve the reporting of the registration of death. As we have noticed in 2030, there is less number of death are registered. So circular issued by the Ministry of Home Affairs. I will not go into detail about this also. And the example we shall see here, how to write the death certificate. Death certificate in part 1, that is part 1 line A, should be written the immediate cause of death, that is septic shock, which is resulted due to infected decubitus ulcer, which due to complication of cerebral infarction, which is due to cerebral arterial sclerosis, and the part 2 insulin dependent diabetes mellitus. This above cause of death statement is a complete, it's a complete form. If not completed properly, information may be missing from the cause of death section. So someone reading the cause of death will not know why the condition on the lowest use line developed. For example, if you write in part 1A, if he is taught the cause of death is pneumonia, and below if you write malnutrition, this example does not explain what caused malnutrition. A variety of different circumstances could cause malnutrition. So the statement is incomplete and ambiguous. Now take the case history. Everyone okay with the speed, or I am fast?
Yes, sir.
Yes. Now we have some case presentation. A 68-year-old A 68-year-old male patient admitted to the hospital with progressive right lower quadrant pain of several weeks duration. The patient had lost approximately 40 pounds with progressive weakness and malaise. On physical examination, the patient had an enlarged liver span that was 4 finger breadths below the right costal margin. Rectal examination was normal and stool was negative for occult blood. Routine laboratory studies were within normal limits. A chest X-ray and a barium enema was negative. His ECG showed a right bundle branch block, and CT scan showed numerous masses within both lobes of liver. A needle biopsy of the liver was diagnostic of moderately differentiated hepatocellular carcinoma, and the patient was started on chemotherapy. 3 months later, 3 months after the diagnosis, the patient developed sharp diminution of liver and as well as deep venous thrombosis of his left thigh, and he was admitted to the hospital. On his third day, the patient developed a pulmonary embolism and died 30 minutes later. Now, this is the case, and how we should write in a cause of death certification, in a certificate of death certification. Here, the immediate cause is pulmonary embolism, and approximate time interval was 30 minutes, which was due to deep vein thrombosis. Subsequently, least condition leading to immediate causes deep vein thrombosis in the left thigh since 3 days. And underlying cause last disease or initiated events was acute hepatic failure since 3 days. And he developed moderately differentiated hepatocellular carcinoma over 3 months. And part 2, all the cause come under the part 1 only, and part 2 that order significant contributing to that but not resulting in the cause of death as in the part 2. The part 2 is kept blank as no contributory condition seen in the history. Now let's see the next case. A 75-year-old male had a 10-year history of chronic bronchitis associated with smoking 2 packets of cigarette a day for more than 40 years. When seen by his physician approximately 2 years prior to his terminal episode, he had moderately reduced his FEV and FVC with no response to bronchodilators. During his last year, he required corticosteroids to prevent wheezing and coughing at night. However, he was unable to reduce his smoking to less than 1 pack of cigarettes per day. When seen 3 months prior to his terminal episode, he had significantly reduced FEV1 and FVC. These are nothing but measurement of the amount of air you can forcibly exhale from your lungs. FEV, or first expiratory volume in 1 second, is volume in 1 second. FVC, force vital capacity. This is the force vital capacity, is the full amount of air that can be exhaled with efforts in a complete breath. Now, he awoke one morning complaining to his wife about coughing and worsening shortness of breath. He was taken to the emergency room where he was found to have an acute exacerbation of obstructive airway disease. He was admitted to the hospital. At the patient's request, no mechanical ventilation was employed and he died 12 hours later in the respiratory arrest. Now how we will write the form here? Medical statement of cause of death. See here, the immediate cause is acute exacerbation of obstructive airway disease, which occurred 12 hours, chronic bronchitis in line B since 10 years, which lead to acute exacerbation of obstructive pulmonary disease. And line C and line D are kept blank, and other significant factor condition contributing to death but not resulting in the cause of death is being given as a cigarette smoking. In this case, respiratory arrest is considered a mechanism of death and it will not be listed as immediate cause of death. Okay, understood? Now, a 92-year-old male was found dead in bed. He had no significant medical history. Autopsy disclosed minimal coronary disease and generalized atrophic changes commonly associated with aging. His age was 92 years old and no specific cause of death was identified. Even toxicology report was negative. Then what will be the immediate cause of death? The cause of death has been not given here. The history or the patient does not serve as the cause of death. The undetermined natural causes should be written here and the approximate time interval is unknown. In some cases, no overwhelming cause presents itself. It is acceptable to identify that a thorough investigation was performed. However, no cause could be determined and we should write the death certificate in such a manner. Can someone die for no reason? It is a sudden death in a rare but tragic event. Sudden arrhythmic syndrome, that's SADS, is a sudden death or unexpected death. A death of adolescents or adults mainly dying during sleep. That is called Brugada syndrome. And here only one cause is given as undetermined cause, which is a sudden arrhythmias death syndrome. The next case, first go through this slide. A 68-year-old female was admitted to ICU with dyspnea and moderate gastrointestinal pain. These cases are before the COVID cases. If such cases comes during the COVID or during this pandemic, we would have differentiate these cases and relate to the COVID-19 also. A 68-year-old female was admitted to ICU with dyspnea and moderate restorational pain of 5 hours duration, 5-hour duration, which did not respond to nitroglycerin. There was a past history of obesity, non-insulin dependent diabetes mellitus, hypertension, and episodes of non-exertional chest pain, diagnosed as angina pectoris since 8 years back. Over the first 72 hours, she developed a significant elevation of MB isoenzyme of creatine phosphokinase, confirming an acute myocardial infarction. A type 2 second degree AV block developed and a temporary pacemaker was put in place. She subsequently developed dyspnea with fluid retention and cardiomegaly on chest radiograph. She improved with diuretics. Here. On the seventh hospital day, during ambulation, she suddenly developed chest pain and increased dyspnea. An acute pulmonary embolism was suspected and intravenous heparin was started. The diagnosis of pulmonary embolism was confirmed by a ventilation or perfusion scan as well as arterial blood gas measurements. 1 hour later, she became unresponsive and resuscitation efforts were unsuccessful. Then how we can write the cause of death here? Yes, the immediate cause of death is the pulmonary embolism, which started 1 hour back, and subsequently least condition in a part 1, that's line B, that is due to acute anterior myocardial infarction since 7 days, and the part C, part first line C, we can write chronic ischemic heart disease since 8 years, and other significant conditions contributing to death but not resulting in cause of death should be written as non-insulin dependent diabetes, obesity, hypertension, and heart failure. In this case, non-insulin dependent diabetes mellitus, obesity, hypertension, and congestive heart failure all be considered factor that contribute to the death. However, they will not be in a direct causal sequence of part 1. So they will be placed in part 2. This is also when a detailed case history. A 75-year-old female had a 15-year history of non-insulin dependent diabetes mellitus, a 13-year history of mild hypertension treated with thiazide diuretics, an uncomplicated myocardial infarction 6 years prior to the present illness. She had found disoriented in her apartment and brought to the hospital. On admission, she was noted to be unresponsive, without focal neurological signs, and adversely dehydrated with a blood pressure of 90/60. Initial laboratory tests disclosed severe hyperglycemia, hyperosmolarity, azotemia, and mild ketosis without acidosis. A diagnosis of hyperosmolar non-ketotic coma was made. Patient was vigorously treated with fluids, electrolytes, insulin, and broad-spectrum antibiotics. Although no source for infection was documented, within 72 hours, the patient's hyperosmolar hyperglycemic state was resolved. However, she remained anuric with progressive azotemia. Attempts at renal dialysis was unsuccessful, and the patient died on 8th day in severe renal failure. Detailed case presentation has been given here. Then how we will write the cause of death certificate here. C. The immediate cause will be the acute renal failure since 5 days, and in part 1 B we will write hyperosmolar non-ketotic coma, diabetic mellitus, and in part 2 we can write the hypertension, previous myocardial infarction. In this case, the hypertension and previous myocardial infarction would both be considered factor that contributed to the death. However, they will not be in a direct causal sequence of part 1. So they will be placed in part 2. This is also one example. This is one case presentation. A 34-year-old male was admitted to the hospital with severe shortness of breath. He had a 9-month history of unintentional weight loss, night sweats, and diarrhea. The patient had no history of any medical condition that would cause immunodeficiency. An ELISA test was confirmatory. Western blot test for human immunodeficiency virus were positive. T lymphocyte test indicate a low T helper suppressor ratio. Lung biopsy was positive for pneumocystitis carni pneumonia, that is PCP. indicating a diagnosis of acquired immunodeficiency syndrome. That is AIDS. Patient's pneumonia responded to pentamide therapy and the patient was discharged. The patient had 2 additional admission for PCP, that is pneumocystitis cardiac pneumonia. And 17 months after the patient was first discovered to have AIDS, he again developed PCP, that is pneumocystitis cardiac pneumonia, but did not respond to therapy and he died 2 weeks later. Now see the form certification form of that. The immediate cause here will be the pneumocystitis cardiac pneumonia, and subsequently list condition will be acquired immunodeficiency syndrome, and the C which is not applicable, D also not applicable as there is no consequences factor, and the other significant condition part 2 contributing to death but not resulting in the cause given in part 1. HIV is written here. By definition, AIDS is due to HIV infection. By definition, AIDS is due to HIV infection. HIV contributes to the developments of AIDS. So it is listed in part 2. AIDS initiated the causal sequence and is listed as the underlying cause of death in part 1 also. If a man had instead died, we'll see the next slide. A lady was admitted with 80% suicidal burns. Suicidal burns injured, died of septicemia after 3 days of hospitalization. Now how will be the part 1 in the immediate cause contain the septicemic shock since 3 days. In the part 1, the B lines we can write burn, that 80% superficial or deep burn since 3 days, and the part in the line C we can write intentional self-harm by fire and flame since 3 days. In part 2 there will be need. The part 2 is kept blank as no contributing condition seen in the history because she was intentional self-harm and died by septicemic shock. The manner of death here is the suicidal death. A 33-year-old male patient was diagnosed HIV positive 5 years ago. He was transferred to hospital for palliative care after he developed AIDS and diagnosed with pneumocystis cardiac pneumonia. Same case what we have seen there. The part 1 consists of this one, pneumocystis cardiac pneumonia, AIDS which leads to AIDS, HIV infection due to AIDS, and kyphosis sarcoma, which is very rare condition. This is the carcinoma of skin or lymphatic tissues or lymph nodes, which is written in the part 2, which is not related to part 1, the cause of death we have given here. See the next case. A 79-year-old female has suffered a right hip fracture due to a fall at home 4 months previous. Since the date of injury, her health declined to the point that it rendered her bedridden and immobile. She has a long history of osteoporosis. Then how will you write the death certificate? The part 1, that is immediate cause, that is final disease or the condition resulting in death, or the respiratory arrest. This is something, but the cause of this injury fracture has been reported. This slide I will not take. So, my dear friend, death is final and when the life is full of possibilities. When the death is certain, let us sacrifice it for a good cause. Thank you. Thank you very much.
Thank you so much, sir, for such an informative session. To discuss were very common and prompt. Clarification were given by you was excellent. I think all the participants are satisfactorily and sufficiently enlightened by your lecture. But still, if there are any queries or questions, please post in comment box or raise your hand on the screen.
Till that you take question answer session.
Okay, here are some questions over here. from Dr. Anil Bazare, our secretary, sir. Sometimes we know the dead person, we know he is bedridden, and conditions or old age or chronic illnesses like CA, CCF, CKD, etc. And or she dies suddenly at home. Should we certify the death without mentioning the cause in sudden cause of death with mentioning the antecedent cause as like old age or bedridden conditions or low intake or chronic diseases? Sir.
Very beautiful question to answer. Come on, Mujahid.
Can you repeat the question? I'm not seeing on my screening. Just a minute.
Okay, again, read again. Read again.
Sure, sure.
Ah.
Dr. Daga, sir,
Dhananjay.
would you please unmute Dr. Bazare, sir, so that he'll be able to ask elaborately?
Yes,
Okay,
sir,
we
yes, sir.
will read. Sometimes we know the dead person.
He is unmute already.
Okay.
Okay, let it be. Sometimes we know the dead person. We know his bedridden condition or old age or chronic disease illness like CA, CCF, CKD, etc., etc. And he or she dies suddenly at home. Should we certify the death without mentioning the cause? Query. Another question, cause in sudden cause of death with mentioning the antecedent cause as like old age, bedridden condition or low intake or chronic disease like. Very beautiful question to answer.
Yes, very, very beautiful question.
It is full toss to you.
Yes, yes, yes.
Now,
I've taken one slide over here. In some cases, yes, sometimes we know the dead person, and we have know his conditions also, since he was having the old age and chronic diseases like CA, CCF, and CKD, etc. And if she dies suddenly, the death here written should be, if the cause of death is not written, the antecedent cause should be undetermined natural causes. The senility is also one of the cause of death should be written here, and that too should be determined in part 1A only, that is in the immediate cause. In some cases, no overwhelming cause present itself. It is acceptable to indicate that thorough investigation was performed and she died of no cause could be determined in this case. Have you got
Dr.
Anil
Kundale,
sir?
sir, is there?
Yes.
If you want
Means
to add something.
the sudden cause of death column should be mentioned here. Curie cause or undetermined cause. Hello.
Yes, yes.
Hello.
Continue. Continue, sir.
येते आवाज येतोय तुमचा बोला.
Hello. Should we mention in the sudden death column undetermined natural cause? Undetermined cause or Curie cause?
Question mark. Let me answer very clearly. Question mark cannot be written in that. Number
Yes,
one.
question mark cannot be written.
It is very. He has made it very clear during his speech.
Okay.
And the disease condition diagnosis should be written, and not the mode of death should
That
be
should be
written.
written.
Just in, I'm simplifying his words. I think it is very clear. Again, Dr. Mujahid, you want to add something to that?
No, the cause of death, sudden cause of death has been mentioned here. If the sudden cause of death is not determined, we can write an undetermined cause. See, as due to age, he may be having the main pain, but that was not determined at the time of death.
Yeah, and if you know the disease condition like CA and all those things, you can write
Yes,
it.
yes, we can write it.
Yeah, or other, it's other significant condition contributing to the death.
Yes.
Yeah, in that you can write it. If it is not directly related to cause of death.
Exactly.
Sir, may I ask one thing?
Yeah.
Hello.
One thing, sir. One more question, Mujahid. Just I think it is answered in this question only. Dr. Ullas Kute wants to ask death at home.
Similar question.
Due to old age. I think he has answered.
Yes, this is our answer.
Question is similar, sir.
Now, take somebody Dr.
Sir, this
Dinesh
is
Patil.
Sachin
this
Patil.
is Dr. Sachin
may
Patil
I
from
ask
Nasik. Hello. So this is Dr. Sachin Patil from Nasik.
Yes.
Yes, sir.
Sir,
Proceed, sir.
can I ask one thing, sir?
Yes, sir. Yes, sir.
If it is a natural cause and cause of the death is undetermined, so isn't it a straightway indication for post-mortem examination then? If
Even
it is a
autopsy.
natural,
No.
if
What case we have disclosed?
It's not
Autopsy or
straightway
disclosed?
indication. It's not
It's not.
straightway indication. Mujahid, you tell.
Yes. See what the case we have discussed. The autopsy was disclosed. Even autopsy was done for that patient. Yes, we can. If we want to determine the cause of death, we can send the body for postmortem.
When you write the cause of death and if the police, it goes to police station, and if the investigation officer accepts, then postmortem is not done, and he says that postmortem is done, then the body is sent to postmortem.
I mean,
Otherwise, disposal warrant is issued, and body
what
is
he is.
allowed to disposal.
See, autopsies are not always required prior to making a professional medical legal determination as to cause of or manner of death. However, an autopsy can be performed if the medical legal examiner determines in their sole discretion that it is necessary in order to determine the exact cause of and manner of death. See, the disease generated in this way may not correct the cause of or manner of death. But autopsy has been performed here. What case we have discussed? The autopsy disclosed the minimal coronary artery disease and generalized atrophic changes, which is commonly associated with the aging, and no specific cause of death was identified in this case.
yes,
In such cases, we can write immediate causes as undetermined natural causes.
yes, but it is when we conduct autopsy.
Yes,
A clinician should not write like this undetermined natural cause.
Okay.
Clinician should always conclude
Maintain.
what the diagnosis is. If he is not coming to perfect clinical diagnosis, he should send it for autopsy.
Clinic autopsy. Because in this case, the autopsy was performed.
Yes, yes.
After performing autopsy, the cause was not known.
Yes, autopsy surgeon can do it.
Yes.
Great, Dr. Sachin Patil.
Very good. And good
What is your
question.
specialty, sir?
So I am professor in Agatyantra in one college.
Great,
Good,
sir.
good.
Then
Good
you
question.
should come, instead of putting questions, you should answer. Right. I got the little bit hint from your explanation. Thank you. Which college, sir, you belong to?
Sir, Nasik.
Good.
Okay. Great.
Nice question and appreciable.
Are there any more questions?
Sir, I am here. Hello.
Yes.
Ah, sir. You're audible, sir.
Yes. Can we write in part 2 of the death certificate? Again, it's a supplementary question. You can say this. The terms like old age or low intake or malnutrition.
See, if the part, yes, complete your question first.
Yeah, I have completed.
Yes.
Only
if
the question is.
Yes, repeat. You are saying something. Sorry for interruption.
Only the question is, can we write terms like old age or malnutrition or low intake or bedridden condition in part 2? The terms like old age or malnutrition or low intake.
See, the part which is not related to the part second you are saying, no? The part second which is not included for the cause of death, that may be included in part 2.
Here I would like to add one more thing.
I have a question of
Bazari sir, I want to add one sentence to this. As far as possible, old age, this particular word should be avoided if there other possible causes are available. As far as it should be avoided. People do the commonest, write it in 1A. It should be avoided as far as possible. If you know the the cause of death, like
Cause.
myocardial infarction,
Chronic illnesses.
pneumonitis, coughs, and in
Those
absence
are
of all those
those
things,
are
it
the
will last
underlying
should be this one last, but should be refrained to write these
sir,
things.
MI,
Huh.
yeah, MI and other pneumonia are the underlying causes, but the
But most of the times,
old age. That I have a question about the terms. Terms can we mention as old age in the death certificate? Old age or low intake or
straight away I have
malnutrition?
answered. As far as possible, you should avoid this
Avoid
word.
all this.
Okay.
If other possible diagnosis is available, last resort you can.
Just
Mujahid, you want to add?
thank you.
No, nothing. You answered all. Thank you, sir.
Sir, first, please clarify to the viewers that what is certificate of cause of death and certificate of death.
Yes. Very beautiful leading question, Dhananjay.
Many people are confused between that.
Yes, yes. MCCD and Mujahid, come on.
Cause of death, and I'm not getting properly here.
Yes, his question was, what is difference between medical certificate of cause of death, which we call in short MCCD,
Yes.
and apart from what is certificate, death certificate? You got? Dhananjay, again repeat the
Yes,
question.
sir. Yes, sir.
And death certificate. Differentiate.
Dhananjay?
Yes, sir.
Mujahid is answering or not?
No, sir. No, sir.
You are answering?
No, sir. You answer, sir.
Okay, very simple thing. What physician is handing over to the patient's relative after the death of the patient is medical certificate of cause of death. It is just a certification that by which cause the patient has died. And when this, along with the other formality, when this form is submitted to local self-government or municipal corporation or Nagar Parishad, after completing all the formality, the municipal corporation issues cause of death, and in cause of death, the medical certificate of cause of death is not written in death certificate. In death certificate, cause of death is not written. His name, age, all data is there. So it's a medical documentation. It is a responsibility to be completed by a doctor only.
Another very common question is there, sir. While giving the death certificate, what performance should be there, or what are the prerequisites that presume that the person is dead? Whether we must write heart rates, respiratory rate, plantar reflex, pupil reflexes. There are a number of things that are responsible to make a person as dead. But
Yes,
what
yes.
particularly things should be noted in a certificate of death by a clinician?
ये quotation आगे.
Is Dr. Kothare there, sir?
Discard.
Dr. Nitin Kothare.
Somebody is annotating.
Hello.
There was a little disturbance. Somebody is writing on the screen, so it is disturbing to a speaker. Why people adopt this tactics, I don't know. All people have come here to gather the knowledge.
Nitin Dada. Hello. Hello.
Hello, sir.
सर नितीन कोथरे सर आहेत ना तिकडे?
आहेत ना, त्यांचं दिसतंय नाही ते, पण त्यांनी कॅमेरा ऑफ केला वाटतं आणि माईक त्यांचा ऑन आहे
हो ठीक.
पण माईकचं आयकॉन दिसत नाही
नाही आहे माईक ऑन आहे मे बी कुठेतरी just बाहेर असेल.
ओके ठीक आहे व्हॉट वॉज द क्वेश्चन
The question was that what clinician must write in death certificate? Exactly what symptoms or what must prerequisite signs which particularly must be mentioned in death certificate? Because Dr. Pathan has enlisted the particulars which are responsible to make a person as dead, but all these things cannot be mentioned at a
तू
home.
बोलत का नाही
आवाज बंद झाला होता.
बोल तू बोलत नाही
हा आवाज बंद झाला होता. स्क्रीनच बंद झाला.
ठीक आहे तू बोललेला ऐकू येतंय दादा तू कंटिन्यू करा सर कुलकर्णी सर
Sir. The question is simple, is as simple as that what particulars must be mentioned in certificate of death by a clinician.
that format was there no Mujahid again take that format yes take any format that form was there no blank form 4A or 4 or 4A
No, not
4A.
that, sir. In death certificate.
Yes, very. It is there. This is 4 or 4A. 4. It is 4.
It's 4 or 4A.
It is very simple. Name of hospital, ward number, all the data. Then whether what is the gender of this, what is the age at death, all this particular. Then again the same cause of death 1A, B, C, D, 2, and then manner of death, whether it was natural, accidental, suicidal, homicidal, or the death.
I am not asking certificate of cause of
what
death.
you want to you come to that come out with that information, Dhananjay. Dr. Sachin, you want to add something?
Sir, basically while declaring death, we must see three vital systems of the body. One is your neurological system, one is central nervous system, cardiovascular system, and third one is respiratory system. And
yes.
when you declare death, you should write down your notes if it is an institutional death. We are speaking about institutional death. When you declare death, you should complete your notes on your hospital indoor sheet. You need not write all these things on this particular form. It is very much clear. Pupillary reflex is absent, or pulse absent, ECG is flat. These notes to be put on your IPD paper, institutional.
Supporting. Yes. These are the supporting things. Yes.
You need not write all these things on certification for cause of death.
On MCCD, but the note should be comprehensive.
Yes, you should finalize. You should end up your notes with
yes,
paper with all these notes.
Yes, you are exact.
And many people forget to note the plantar reflex.
Yes,
It
all
is
neurological thing. One is pupillary reflex. Second is your plantar reflex is absent. Pupillary reflex dilated pupils and they are fixed. Dilated, both the pupils are dilated and fixed. Plantar reflex absent. These are neurological things are over. Then coming to cardiovascular system, ECG is flat, pulseless, heartbeat, no heartbeats. Then respiratory, air entry is absent. That's all, and is to be declared dead. These vital parts you should mention on your case paper, not on this certificate of 4A.
If you observe the practice of the practitioners in private general practitioner or private hospital practice, people are little bit symptomatic. In GP, I have seen that people are not having any comprehensive notes, no clinical notes, and the reason they adduce, I charge very less money. This is not the reasoning to adduce, because if you go in court of law, law says what you have not done is not written on your paper. So absence of clinical notes, it clearly tells that you have not observed the proper formality, and person can drag you to the court of law. Yes, this you want to say.
Things they become difficult when you have a broad dead kind of case.
Yes, yes.
Broad dead kind of case, you are always in dilemma what to do, what not to do. So
You should
straight
complete all the
away
formality.
answer, yes, straight away answer to it is send it to some higher hospital or straight away civil hospital.
Was in broad dead also, but in broad dead, the doctor has to see the patient anyway and declare that.
Yes.
The question arises as to death certificate or cause of death.
Yes.
And information to the police and what records to keep.
Yes.
So in this case, always attend the broad dead patient and prepare an OPD case paper and write down the history given by the relatives and record at least 2 identification marks of the dead body and declare the death after careful examination and auscultation for at least for 5 minutes. If possible, ECG recording must be done in case of broad dead patient. And in case of any suspicion, do not hesitate to inform police and ask them to take necessary actions. Keep your OPD record carefully. And these are to be done for a broad dead patient.
Yes.
Yes, and such a broad dead patients, if they have taken to some hospital, and if you are thinking from organ transplantation, then the formality is something more in detail. He has completed in that previous slide. Mujahid, you show that previous slide.
Which one?
For organ transplantation, the necessity from that angle. That was there, no? One. All neurological examination, then
Exactly.
it should be confirmed with the minimum 2 physicians.
Yes, sir.
From that was there, no, one slide was there. I saw it. No, previous. Okay, it has to be completed in all formalities should be
There.
observed.
Means careful about, we should always be careful about records and examination. And whenever possible, we should cooperate with law also.
Another adducing question to that matter, sir. What are the legal implications or what are the penal actions which may be attracted if there are any irregularities in the certificate of death or certificate of cause of death?
Regularities and
Irregularities in the certification. What are the penal actions or legal sections which are attracted?
this answer maybe Kotle sir will answer this.
Okay, sir.
Or if you have ready answer, go ahead,
No.
No,
Dhananjay.
sir. I'm not having any answer. I just adduced that information. Regarding just general information, forgery section 463 and 464 are attracted generally, which are punishable as 2 years imprisonment and fine. The available questions. But if there are any serious offences and the certificate has been issued in such offences, or a certificate comes in court of law, certain serious sections like 420 or 201 of wiping the evidence, or 202 intentional omission, certain sections can also be attracted. So we have to be very careful and cautious regarding the giving
Yes.
of such certificates, which are having very great value in court of law.
Yeah, in many incidences are there that patient is dead, somebody comes, we certify the cause of death, and after some period we find that it was a suicide, it was a murder, and the whole story takes a undue turn.
Worst is 304B, sir, dowry death. Worst thing is that. Is Kothari sir connecting or?
I didn't get.
Nitin Dada?
I think he is there.
Nitin.
Are there any questions or should we conclude, sir?
If there are no any question.
May I add something?
Yeah.
Sir, please, sir. We were waiting for you.
Yes, sir.
आवाज आ रही है क्या?
आ रही
आ रही है सर.
बहुत जोरों से आ रही है.
Shall I add something for section 304A?
Dhananjay rightly said about this wiping of evidence and all that forgery. Two things are there which is necessary. One thing is 197 can be affected, issuing and signing a false certificate. And the worst thing is you can be held as a ROP, that is accomplished. That person has assisted in doing such type of murder as said by Khatakar sir. So these things
Yes,
should be taken into mind.
Means that come under section 304A, causing death by.
304B. 304B.
Acha, okay.
Dowry death.
197 issuing and signing a false certificate.
That is common, sir.
7 years, 9 or both.
In banking sector or insurance sectors, if there are false certificates, 420 is attracted generally.
420
It is non-bearable.
Documentation purpose,
Yes, sir.
wiping of evidence for criminal cases, and
Yes, sir.
injury.
Section 192 for fabricating false evidences and section 197 for issuing or signing false medical certificate.
Correct. Punishable by section 193.
With 198 using that certificate.
But we should refrain ourselves by, under any pressure or any social or political pressure by giving such certificates, false certificates, under any condition.
See, basically the court asks the doctor to set the standard of care themselves. And in this case, the jury usually decides in favor or against doctor after considering the following related question. Was the medical history taken properly? What did the patient complain of? And what pain was he is? And was he examined properly by the doctor? And was the risk assessment made? And where all the options of alternative considered was obtained? Or where the appropriate tests were ordered? This question jury always asks.
Here, just I wanted to add one different experience. Shall I quote? Shall
Yes.
I take 2 minutes?
Sure, sir.
Sure.
This experience, this mistake, this was a mistake, error. Many times, medical practitioners commit. Like he was my friend. He was a general practitioner, and one evening, this was 10 years back story. One evening, few 2-3 people came, and one labor is dead there, nearby in the nearby vicinity, and one corporator was also there, and he requested to certify him as his death. And in good faith, that fellow went there and he certified, and went and he just saw and didn't take proper precautions, and he gave a death certificate, and everything went on. And after 6 months, one police inspector came to his clinic and inquired about this death certificate. The story was that like this, that this male labor who was died, one person has sent a unnamed letter to a police station that this person who was dead was a labor. His wife was having illicit relations with another person, and this could be a murder with these two involvement of these two things, these two people. And then the whole story of criminal justice wheel came into motion, and this fellow again went on. Then at that time he had not preserved the copies also, because 6 months had passed, and he had to go under the tremendous ordeal. It was a very tough experience for him. So as you say that confirm the cause of death by all means, as Dhananjay has said, by examining various systems and all those things. And
And
those
at
don't
times
succumb to.
court looks at it the criminal offences are registered to release section 34 in these cases. Furtherance
Don't
of common
succumb to
intention.
don't succumb to pressure tactics of mob or local corporator or social workers. You perform your duties in a right manner with due precaution and due care.
Sir, he had given just death certificate or cause of death certificate.
No, death certificate is
Cause
given
of
by
death.
municipal
Cause of death.
corporation. Doctor gives is a MCCD, medical certificate of cause of death.
Yes.
We give certificate that this person has died because of this. What we give is a medical certificate of cause of death. After submission, then corporation gives the death certificate.
This is Form 6. Mrityu Praman Patra, we called it.
And in death certificate, cause of death is never written. Huh?
Are there any questions, sir?
I think if they otherwise conclude.
Yes. I would like to request Dr. Sachin Patil, sir, to give vote of thanks.
Yes, sir. Yes, sir. So very good evening to dear friends. First of all, I would like to thank office bearers of NIMA for this wonderful series of webinars and thank them all to give me an opportunity to propose vote of thanks today. On behalf of NIMA Pathology Society, we would like to thank Dr. Mujahid sir for his wonderful presentation on death, its medical certifications and ICD codes. Death is something which a clinician is always scared about, and he has very little knowledge of it. How to certify death is probably a most neglected part of our practice and our academics. We are grateful to you, sir, for improving our knowledge regarding this subject. I also thank Dr. Khataukar sir, Dr. Nitin Makure sir, and Dr. Dhananjay Kulkarni for adding knowledge to all of us. Thank you very much, sir. I again thank Dr. Daga sir, Dr. Dhadwe sir, and Dr. Alok Gupta sir for their efforts in arrangement of all these webinars. I must extend our gratitude towards these. Lastly, I am thankful to the participants who have enjoyed this kind of webinar. Thank you very much.
Over to you, Daga, sir.
Yeah. Thank you, Dr. Sachin, Dr. Dhananjay sir, and most thank you to Dr. Pathan sir, Dr. Khataukar sir, Dr. Nitin Kothare sir, for an excellent and to the point presentation. Really, as Dr. Sachin Patil told, this is the most neglected part in our practice, and you have stated so briefly and so minutely that definitely by listening this lecture, most of the points get clear, and we will be get alert in next time by producing not only death certificate but also the other certificates.
That's it.
So I thanks to all the office bearer, and thanks all the participants. Thank you, sir. Khataukar sir, करायचं conclusion?
Okay. Yes. Please.
Pathan sir?
Yes.
Thank you. Dhananjay sir?
Sir. Yes, sir.
Raju sir, करू conclude?
करा.
Sachin sir, bye.
Yes, sir. Bye.
Thank you.
Thank you.